Estimates range from 10,000 to 20,000 expats, mostly of retirement age, in San Miguel de Allende during the year, not counting tourists. Some have businesses here, some live here, some just pop in and out. When health issues arise, they have to either pay out of pocket or enter the Lakeside Medical Group, which offers services to manage many health issues for expats from the United States who have various Medicare plans and Canadians that travel who have travel insurance for emergency and urgent care coverage, all through Hospital MAC here and at various other places elsewhere. The way it works, you sign up for Lakeside, which is a free service. You have medical issues, you call Lakeside. You tell them in English what's going on. If you need an ambulance, they will arrange it. And then when you get to MAC, you give them your Lakeside card and your official Mexico ID, and you get served. What a peace of mind that can provide. No deductibles, no coinsurance, no copay at MAC. And Lakeside representative Robert Ash will provide an overview of Lakeside services and answer questions. Robert is in charge of most of the Lakeside membership in Mexico as well as in Belize. He's also a great member of this club, and I would like to have you, proud member, please offer your applause and welcome to Robert Ash.
Thank you. Joe, I hope you don't mind if I raise this. So, Lakeside Medical Group. A lot of you have, if you're not a member, you've actually heard about it. Many of you have a lot of questions about it, and I hope that during this explanation, this presentation, you'll have some peace of mind as to what we are. To some people, we're incredible saviors. To some people, we're the devil incarnate. So we're neither. We have basically a very successful business in terms of offering urgent and emergency care to expats abroad. Sorry. Before I get into what Lakeside is, I would like to say a couple of things. First, I am not an insurance agent. Okay, we do not sell insurance at Lakeside. So insurance questions are really beyond the realm of what I'm here to address. I can address some of them because I know a little bit about it. And our program basically works with certain insurance policies, as we will see. I'd like to give you a little background as to what created this spaghetti bowl called Medicare. It is a complex system. It is not easy to navigate. But it turns out that in 1998, the U.S. Congress decided that they wanted to offer seniors choice in their Medicare. Until then, there had been traditional Medicare, which still exists, with Medigap plans to cover the 20% that people who have traditional Medicare are responsible for. This Medicare Choice program in 2002 became Medicare Advantage. Okay, basically Medicare Advantage is now known as Part C. So we have Part A in the traditional Medicare, which is the hospitals. Part B is the doctors, and Part D is the pharmacy, the drugs. Oh, sorry. Here we go. So what the U.S. Congress said is we're going to put all those three parts, Part A, Part B, and Part D, into one single program called Part C. And Part C is now known as Medicare Advantage. Okay, Medicare Advantage is basically a program. It's Medicare run by private insurance companies. So all the rules and regulations that apply to traditional Medicare, a lot of them do not apply to Medicare Advantage. Medicare Advantage, by design, was created to give more options. Therefore, these private insurance companies are giving more options to retirees. And we will go into that a little bit. All right, so what are we? Lakeside Medical Group is basically a comprehensive managed medical care program in Mexico and only in Mexico. Okay, it does not change your Medicare Advantage program at all. It has no effect in the US. It has no effect if you're in Thailand or France and get sick. It only applies for Mexico. That is one of the principal concerns that a lot of people have. Okay, how do we work? We have a direct billing relationship with most Medicare Advantage providers in the US. Okay, and I will go into what the process is that we use to clear that with the insurance companies. And why do we only use certain hospitals? In order to receive a service from Lakeside Medical Group, you must go to an in-network hospital. These hospitals, and here in San Miguel, that hospital is Mac Hospital. All right, there are 22 MAC hospitals around the country. And we have an agreement with MAC hospitals in Mexico. So if you're in Mexico City, if you're in Merida, wherever there's a MAC hospital, chances are it's an in-network hospital. And you must attend those hospitals in case of emergency to be able to get your emergency or urgent care taken care of, your treatments, with no deductibles, no coinsurance, and no out-of-pocket expenses. Okay, so where are we? Lakeside Medical is a nationwide program. All right, although we are based, and we have been based in Chapala, in Guadalajara, outside of Guadalajara, for 15 years. All right, we are in 21 states around the country. Most of the areas that Lakeside serves are traditional expat communities. All right, so we would probably not have, for example, last week I was asked about San Luis Potosí. Okay, we don't have a hospital in San Luis Potosí. Why? There are very few expats in San Luis Potosí. So you can go to any of these cities around Mexico and know that you have emergency and urgent care coverage. Now, one of the things before I go into this, we have 2 hospitals in Querétaro that are about to sign an agreement with us. All right, it has taken a little while, and we have really not pushed them very much because we are topped out in Mexico, basically. Our program is very successful. Our program has enrolled, we have over 10,000 members now. That's the number I've heard. In Mexico alone, we've just expanded to Panama, to Belize, and we're going into Turks and Caicos and St. Martin. So it's proven to be a very successful program, and it is a good program that works for expats who need care. And we've just heard 2 examples of people who need care here in Mexico, and basically you're getting that care for free. Okay, and I will explain a little bit more about what I mean by for free. So, no deductibles, no coinsurance. Depending on your emergency, on your insurance program, you may have only emergency and urgent care, and that is 90% of the people that we have that are enrolled only get emergency and urgent care. There are certain people like U.S. government retirees that have a complete package, and they can go anywhere in the world and receive complete and absolute care. A toenail hurts, they can go to the hospital. So there are certain, and we work according to the underlying insurance plan. So we just mirror whatever the plan is that the patient or the member has. All right, and this is very important, and I was just asked about this today. Down at the bottom, down here, okay, we always say that you go to the hospital and pay nothing. That is true. We will charge you afterwards. Okay, we will charge you anywhere between 100 pesos and 3,000 pesos. That is the sum total of what you pay for going to the hospital in an emergency or an urgent care situation. 3,000 pesos applies if you stay overnight. All right, that is one night, or that is 10 nights or 20 nights. It's 3,000 pesos. That's what you pay. All right, so there is a charge for using Lakeside, but you will not pay it at the hospital. You'll pay when you come out. We will charge you. Excuse me. I better hurry along. One of the questions that we're always asked is, yes, but you guys are tricky. What does emergency mean? What does urgent care mean? Okay, we use the American Medical Association definitions. Basically, an emergency is a sudden change in your medical condition that requires immediate assistance and without which you could lose life or limb. Okay, and these are some examples of what emergency is. So we're not making this stuff up. Now, what is urgent care? Urgent care are illnesses or injuries that require prompt attention, but do not threaten life or limb. So stitches, if you have bad sinus infection, if you have a stomach infection, that's urgent care. All right, and all of that can be taken care of at the MAC hospital here. No deductibles, no coinsurance, no out-of-pocket expenses. Now, when you joining is free. You must have a Medicare Advantage program or an insurance program that allows for emergency and urgent care abroad. We have a lot of digital nomads that are members of Lakeside, especially in Mexico City. So you receive this welcome guide. It is important that it is read. Okay, basically the welcome guide tells you who we are, what we do, and what we need you to do in case of an emergency or an urgent care situation. All right, we request that you always call us before heading to the hospital. Why? A couple of reasons. The most important reason is that we need to authorize your going into the hospital and that it truly is an emergency. Okay, so you will call us, we will answer it in English, and we will, chances are it's a doctor that's answering, and we will listen to what it is that you have, okay, and we'll say, okay, yes, go ahead and head to the hospital. The second reason we want to hear from you beforehand is, and we're going through this right now, every year, Advantage programs change. Every year. Okay, so we want to make sure that the Advantage program that you joined with is still compatible with our program a year later because you have a different insurance company or a different insurance plan. Okay, because it's the nature of the beast. Okay, so every year it's changing. We just want to make sure. All right, so and we are also, a lot of you, because I know there are a lot of members in this room right now, a lot of you have received emails from Lakeside saying, please ensure to send us your new card. Because people forget, right? We have a life going on, so we just forget to include the new card. So basically we request anytime that you have any changes, inform us if you're a member. Okay, we want to make sure that you continue receiving the protection and the coverage here in Mexico. Now, the other important thing that you will receive with this letter are the virtual ID cards. All right, it is not imperative, but it is important to print them, to laminate them, put them in your bag, okay, and send them to friends and family. Okay, just in case in an emergency you cannot speak for yourself, you can have a neighbor or a family member say, please take my mom, my aunt, or whatever to the MAC hospital and tell them that she's Lakeside. All right. The other thing is, in case of an emergency and you're out on the road, the emergency Cruz Roja will open your bag. They will go through your stuff to find out who you are and if there are any special instructions. They need to know where to take you. They need to know who you are. Okay, so put this in your wallet. Put this in your bag and leave instructions. You never know if you fall. I mean, the number one reason that people are treated in Mexico is for falls. Okay, it's not heart attacks. It's not anything like that. It's falls, trip and falls. Okay, so that's the number one reason in Mexico. So in the back of the card, you will also see phone numbers, and those are the phone numbers that you want to use to call. All right. So we've got 800 numbers. We have different cities. Although, as many of you know, if we have Mexican numbers, phones, you can dial any city within your plan. So it doesn't really matter where you are. Okay. So from here, you can call Chapala without a problem on your cell phone. For American numbers, for American cell phones, we have, we have this number. All right, there's on the bottom one it says US. If you have a cell phone, an American cell phone, you can dial that 800 number and it rings in Chapala. Okay? So now here, these are important points. I'm trying to wrap it up quickly. What do I do when I get to a network hospital? Okay, I show my card. Or I tell them that I'm Lakeside. Because if I have not had a chance, and most people do not call us during an emergency before getting to the hospital. Most people just freak out and just go to the hospital. Okay, I know I got to go to the MAC, and that's where they go. When they're received at the MAC, what is the first thing that the MAC asks? Credit card. Okay, because they're trained to require a credit card before you receive any attention. Okay, so do not pay up front. Do not show your credit card. Show your Lakeside card. All right, we cannot reimburse. So if you show your credit card, okay, you're seeking reimbursement from your insurance company. We cannot work with you anymore. You lose your Lakeside coverage. So always show your Lakeside card when you get to the hospital, okay? And besides, they need to call us for authorization. So we need to authorize that person going to receive emergency or urgent care treatment. All right. So as I mentioned, please remember to notify us once you're a member. Every year you need to send us your new cards so that we have those on file and you can continue receiving your coverage. Okay, so it's a very simple program. I understand by the chatter on the civil list this week, it is a controversial program, but it is a very simple program. And we work with insurance companies. Just to give you an idea, when you apply with us, which is, again, free, it costs nothing. When you apply to become a Lakeside member, we will ask you to sign an authorization agreement. That agreement basically states what Lakeside is. It states that we are taking over your risk. Okay, because anytime you go to a hospital here and try to use your Medicare Advantage, okay, you will prepay and then you will have to go back for reimbursement from your insurance company. And most insurance companies in the US, as many of you have heard, are trained to deny at first, especially an international claim. Okay, it may take up to a year for you to receive 80% of your money back. Why? Because they will take the deductibles, they will take the co-pays, all of that stuff is your responsibility. All right, you've got to translate all these documents. So we ask you to sign an electronic authorization agreement. A lot of people say, you're going to bill on our behalf. You go in for a toothache and you're going to bill an open heart surgery. Okay, that is not the case. We cannot do that. All right, because we have to submit our claims the same way you do, which is we have to translate everything. We have to include doctor's notes, the hospital notes, x-rays, whatever was done to you is part of the packet that we need to send to the insurance company. All right. The good news for you guys is that you don't have to do it. Lakeside does it on your behalf. Okay. That's why we're asking you to sign ahead of time that authorization agreement. Okay. So we submit that to the insurance company. We need that authorization agreement. Once you sign that authorization agreement as part of your enrollment process, okay, we will go to your insurance company and seek what is called a confirmation of benefits. So we establish an open door with the United Healthcare or Aetna or Humana or whoever it is, and we tell them, listen, what is this person's benefits? Because we need to have that. We need to know exactly what is covered under your policy. Okay? So once we do that and we receive the confirmation of benefits from your insurance company, you're in. You're a member of Lakeside, and you will be covered for emergencies and urgent care here or in any other city in Mexico where we have an in-network hospital. All right? ¿Me das la lámina, la carta? Now, during this week, and I'm wrapping it up now, we received one of the main concerns expressed in the civil list was a lot of us are getting letters of denial of claim from our insurance company. Okay? Am I responsible? Are they going to come after me? Okay? The answer is no. I requested an official letter from Lakeside yesterday that I received from a mothership. And basically, and this is already in the packet that you guys are signing, okay? You are not responsible for any payments or any bills, even if your insurance company denies the claim. Remember, most insurance companies are trained and is part of their standard operating procedure to deny claims. That's our problem. That's not your problem. Okay? Although, you get the notice because you are the member of that insurance company. So what we're asking you to do in this, and down at the bottom, sorry, let me see. Down at the bottom, it says, it is LMG's, Lakeside Medical Group's policy and procedures to file claims and resubmit insurance company denials of claims on behalf of our members. Our members do not bear financial responsibility for denials of service, nor are they required to pay medical bills related to insurance company denials of claims. Okay, so the moment you leave Mac Hospital, you owe nothing to Mac Hospital. And in fact, a lot of you here have received bills saying paid in full from Mac Hospital. All right, and you will not owe anything to your insurance company. That is our problem. We resubmit claims, we negotiate with the insurance company, and also bear in mind that we're filing the claims up there using standard Medicare billing codes. So we're not overcharging, we're not doing any shenanigans up there. It's breaking the law to do that, all right? And we keep very, very strict within the law as far as our operation is concerned. So any questions? Yep.
Yeah, so what happens if I need back surgery? It's determined. And I go to Mac Hospital. Can I, if I need back surgery and I go to Mac, can I pick the surgeon or do they pick the surgeon?
If you schedule any type of medical surgeries or procedures, it is not an emergency and it is not an urgent care situation. So it is not covered.
I go to Mac, They say you need back surgery.
Yes, but
And
at
so
that point, it's not an emergency.
well, what if it is? It happened to me and it was an emergency. And my question is, if it's an emergency, can I choose my surgeon or does Mac choose the surgeon?
MAC does.
Okay, thank you.
Yeah, anything that is scheduled or that you foresee, like knee surgeries, back surgeries, that sort of thing, 1 minute,
1 minute.
is not covered.
Thanks so much for your presentation. I've been a member of Lakeside for 3 years,
Okay.
and I'm on the ARP United Advantage plan.
Mm-hmm.
I went to the MAC in May for some emergency attention, heart-related stuff, and everything went smooth as silk.
Good.
And just great care. But I got back to Minnesota in July, and this letter from United is waiting for me. So is this what you're talking about?
Yes. Yes.
Under your plan benefits, payment requests from third-party billers
Yes.
for
That's what I mean.
emergency services are
Yeah.
not reimbursable.
What we're asking you to do is email, take a picture of that, and email it to staff at Lake Medical Group, and we'll take care of it.
Okay.
But you're not responsible. You bear no financial responsibility for your procedures.
Okay. Just one follow-up. So my policy statement for 2026 is very clearly stating we do not reimburse emergency services to third-party billers
Uh-huh.
outside of the United States.
Mhm.
So I don't understand why their policy says one thing, but you guys are able to work with them to make things happen.
When you first joined, we sent the confirmation of benefits, and under United, there's been a lot of changes in United lately. Okay, a lot, not for the better, and we get that confirmation of benefits from your insurance company. So we will negotiate with United right now. Once we know that, we already know, but once we receive that, we will get back to them and negotiate with them. Yeah. So please send that to staff@lakemedicalgroup.com. Okay.
Okay.
Thank you. I'll be outside to answer more questions. And I know a lot of people, some people already told me they want to sign up, so I'll be outside.
Great. Robert, thank you so much. Thanks for, we appreciate having you as one of our members, and we appreciate all this information as you think about your club as you're drinking your morning coffee. But thank you so much, and we welcome you to continue these wonderful conversations on Zoom and in person in the cafe. Everyone have a great week, and if you celebrate American Thanksgiving, happy Thanksgiving.